For this skills video, I'm going to demonstrate range of motion. For range of motion exercises, we're going to go from the top of the head all the way down to the toes. When you do range of motion exercises on a patient, the first thing that you want to do is come in, introduce yourself, and use hand hygiene, because you're going to be touching your patient. So you come in, you knock. Hi, my name's Angie. I'm going to be doing some exercises with you today, okay? If at any time you feel any pain, please stop me and let me know, all right? You always want to make sure that the patient knows that, because if they have any pain, you want to stop doing those exercises immediately. For range of motion exercises, we're going to start at the top of the head and work our way down. You do have a list of these in your packets and in the textbook that you could follow along with. Practicing these a number of times is going to make the skill a lot easier when you test out. So the first thing we're going to do is work with the head. So when you are working with a patient and you're going to do exercises on their neck, you want to hold their head with two hands. All right, a human head weighs about 8 to 10 pounds. So you want to support this head very carefully when you're doing these exercises. The first exercise is just simply rotation. So if you turn their face away from you and towards you, that is rotating. What you're doing is rotating the head. The next thing you can do is flexion. Flexion is when the joint's getting smaller. So if you take their head and you bend their chin down to their chest, that's flexion. Normal position is extension. If you were to tilt their head back farther, that would be hyperextension. So flexion, extension, hyperextension. The last exercise for the head is doing side flexion or lateral flexion. So if you take their head and you bring their ear to their shoulder, that is lateral flexion, and that is the end for the head. So rotation, flexion, extension, hyperextension, lateral flexion. Next, we're going to work our way down to the shoulder. The shoulder is a ball and socket joint, so it has 3 separate exercises. First is if you take the shoulder and you make the joint smaller with 2 hands always on the patient. You bring the shoulder all the way up. This is flexion, extension. If he was standing, you could also do hyperextension. If you take the arm away from the body, that is abduction. If you add it to the body, that is adduction. If you bend the elbow into a 90-degree angle and you rotate the hand upwards, this is rotating the shoulder, so it's rotation. So when you're waving goodbye, it's external rotation. When the hand's inside, it's internal rotation. From the shoulder, you can go down to the elbow. The elbow only moves one way, so it's just flexion, extension. For the forearm, your forearm only goes, it just rotates around. So if you have it up where the hand is a soup bowl, this is supination. If you have the hand down, it is pronation. Next, we're going to go to the wrist. If you have the wrist and you make the joint smaller, that is flexion, extension, hyperextension. If you bend it towards the thumb side or the radius side, that's radial flexion. To the ulnar side is ulnar flexion. For the fingers, if you make the joint smaller, that's flexion. Normal position is extension. If you separate them, that is abduction. If you add them together, it's adduction. For the thumb, if you make the joint smaller, that's flexion. Normal position is extension. If you take them away from the fingers, is abduction. Add it to the fingers is adduction. And the thumb also has a special 4-syllable movement that is called apposition, where the thumb meets every finger. Next, you're going to move down to the hip. Again, it's a ball and socket joint, just like the shoulder. So if you take the leg completely straight and you lift it up, this is flexion. Normal position is extension. Again, if he was standing up and you kick it back, that would be hyperextension. If you take the leg away from the body, that's abduction. Add it to the body is adduction. With the whole leg straight, if I take and I rotate his foot out in his whole leg, that's external rotation. If I rotate it in, it's internal rotation. Going down to the knee, if I bend the knee, it's flexion, extension. Down to the feet, if I turn the ankle and I turn it inward to make a soup bowl, that's supination. Outward is pronation. If I take and I pull his toes back towards his head, that's dorsiflexion. And if I plant them down on the ground, that's plantar flexion. With his toes, if you scrunch them up, that is flexion. Normal position is extension. If you pull them apart, that's abduction. You put them together is adduction. And that is from head to toe, all of the movements that you need to know for this skill. When you do this skill, you will do it on a partner, and you will say the movements with actually doing that on the partner. So practice them a lot. And that's the conclusion for this skill.